The strategies for safe movement of patients as shown in this video are general in nature. They can apply to many types of patients, but may need to be modified for certain diagnoses, impairments, or precautions that a given patient might have. Thus, for a specific patient, the strategies shown may need modification. If you are unsure of how to safely move an individual patient, it's recommended that you consult with the occupational or physical therapists at your facility. Whenever assisting a patient with movement, it is important to instruct the patient in ways that they can assist with the movement. If the patient knows what to expect because you are communicating with them, they are less likely to move in a way that may come as a surprise to you and throw off your own balance. Also, instructing them how to assist helps promote their independence in completing the movement and makes your job easier, as you may not have to provide as much physical assistance. This video is going to demonstrate how to transfer an individual from a bedside chair to a bed using a squat pivot technique. This technique may be useful for someone who is unable to come to a fully upright standing position, but is able to bear at least some weight on their legs. While this technique can be done with the assist of one person, it will be demonstrated with two assists in this video. Given that a patient who requires this transfer technique cannot come to a full stand, it can often be assumed that they require more assistance, and thus two assists is shown. If only one person is assisting, they would have the same role and positioning as the person shown in front of the patient. An assisted device is not used by the patient during a squat pivot transfer. It is generally easiest to perform this transfer from a wheelchair, but it can be done from a bedside chair if necessary. A wheelchair is easier because with many wheelchairs you can remove the armrests. This transfer is easier if the patient's hips only need to be raised just high enough to eliminate friction, rather than up and over an armrest. Some bedside chairs have armrests that flip up out of the way, but others have armrests that are fixed. If this transfer is being done from a bedside chair, it will be much easier to use one that has an armrest that can be moved out of the way. Prior to initiating the transfer to the bed, you should consider the patient's potential to tolerate the transfer. Recognize that simply sitting up in the chair for a period of time can be fatiguing. The amount of assistance needed may be greater for the transfer back to bed than it was for the transfer to the chair. This video assumes that you have already gathered any items that you may need, such as a gait belt and non-slip socks, prior to initiating the transfer. It begins by showing the wheelchair positioned as close as possible to the bed. The wheelchair should be positioned adjacent to the bed, but at a slight angle rather than parallel. To get the wheelchair adjacent to the bed, the leg rest closest to the bed should be removed. Positioning the wheelchair at a slight angle creates a space for the caregiver who is providing the second assist. Make sure the wheelchair brakes are locked before initiating the transfer. The armrest adjacent to the bed should also be removed. This video also shows the height of the bed at its lowest position. It is easier to do a squat pivot transfer if the surfaces are approximately the same height, or if the surface the patient is moving towards is lower than the other surface. The patient's feet should be positioned flat on the floor. You may need to have the patient scoot forward if needed to position her feet firmly on the floor and shoulder width apart. Additionally, scooting forward in the chair will make it easier for the patient to shift their center of mass over their base of support. The caregiver leading the transfer should be positioned directly in front of the patient with both hands on the gait belt using an underhand grip. She should be positioned very close to the patient to minimize the strain on her back, and in a squat position while maintaining the natural curves of her back. It is often quite helpful to block at least one of the patient's knees during this transfer. To block the patient's knee, place your foot along the outside of her foot and place your leg across her upper shin. The second person is assisting from behind by directing the patient's pelvis laterally during the transfer. He should place one foot in the space between the bed and the wheelchair. With the other leg, he should kneel on the patient's bed after first placing clean linen there for infection control. He should grab onto the gait belt and lean forward at his hips while maintaining the natural curves of his back. Instruct the patient to lean her trunk forward and to push through her arms and feet to slightly raise her hips off the chair. At the same time, rock your body weight back onto your back leg to use your body weight to assist the patient in unweighting her hips. Once the patient's hips are raised off the chair, you can then pivot with the patient to assist her towards the bed. Don't simply pull up on the gait belt. This is uncomfortable for the patient and increases your risk for back injury. Keep your grip on the gait belt and use the transfer of the weight of your body onto your back foot to shift the patient's weight off of her hips and onto her feet. The second person who is assisting should primarily help direct the patient towards the bed. He may provide some upward assist to help clear the patient's hips off the chair. His assist in the upward and lateral directions should make the pivot easier for the caregiver in front. You do not need to pivot all of the way into the bed at once. This video shows how you might go part of the way, reposition the patient's feet so that they don't get twisted, then complete the movement onto the bed. The caregiver in front is the one leading the transfer, so she needs to communicate with the second caregiver and the patient about what to do and when. All three individuals need to work together as a team for the transfer to be successful. For instance, the caregiver in front may use a 1, 2, 3 command to indicate when the patient should lean their body weight forward and when the second person assisting should start shifting the patient's pelvis onto the bed. If the patient has one leg that is stronger than the other, it is helpful to have the patient transfer towards their stronger leg. For example, if the patient has right-sided hemiparesis following a stroke, ideally the bed that the patient is transferring toward is on their left side. The transfer will be easier if you transfer towards the patient's stronger side and thus safer for you and the patient. Of course, if the patient transferred towards their stronger side going to the chair, recognize that on the way back they would be going towards their weaker side. If the patient has been sitting up in a wheelchair, the easy remedy is to just turn the chair around or move it to the other side of the bed. However, if the chair or even the bed can't be moved, you should at the very least anticipate that the patient will likely need more assistance going towards their weaker side. If strength is fairly equal in both legs, it does not matter to which side the patient transfers. The knee blocking method shown in this video is one that I personally prefer and find easiest to do. However, there are other methods to block knees during transfers, such as using both of your legs to block one or both of the patient's knees. I would encourage you to consult your therapy staff to determine how to best utilize these techniques with individual patients. For this transfer or others, it is possible for two persons to assist the patient while both are positioned in front or on each side of the patient. However, this can be difficult because of a lack of space, particularly if the chair is placed so that the distance the patient needs to travel is minimized. In order for there to be room for two caregivers in front or on either side of the patient, the chair needs to be placed further from the bed to make room for everyone. This creates a gap which could be dangerous if the patient would start to fall midway through the transfer, even if two people are assisting the patient.